My name's Morag Forbes. I'm a midwife. I've been a midwife for 5 years, and I've worked in all different settings from home births to high risk labour ward. But what my passion really is women feeling happy about their choices and making informed choices about their labour and birth. I'd done yoga since I was 17 in some form or another. I've done hatha yoga for years, and about 4 years ago now, I found Kundalini yoga for the first time, and I just found it was a much deeper experience and much more challenging to me. Um, and so, from my own experience of really enjoying the yoga, I first of all did a general yoga teacher training in Kundalini yoga. Um, and in the last year or so, I've been thinking, as I've been working in quite a medical and high risk environment, that it would be really nice for me as a midwife as well to focus on how to empower women and how to make their pregnancy and birth journey the most positive that it can be, regardless of the outcome. From the point of view of scientific research, yoga is quite a difficult thing to study because there are so many different schools of yoga, so many different approaches, and also it's difficult to know how often the person's doing yoga. So the research on yoga in pregnancy is quite limited. Um, what we can say with some confidence is that exercise in pregnancy is beneficial. It's good to keep active in pregnancy, and it's also good to reduce your stress levels as much as you possibly can in pregnancy. And some studies suggest that there may be a reduction in stress levels due to yoga. Women also, in a lot of studies, have reported that if they use yoga in pregnancy, they feel less pain during the birth. But again, these are difficult things to measure and to say with certainty. So I think the most important thing is for a pregnant woman to try yoga for herself and to see how it feels for her. From my own experience, I've found that Kundalini yoga really helps you to deal with your own stress and psychological issues that come up for you. And in the 9 months of pregnancy, it's a great time to focus on any issues that you have, and also to think about how you're going to cope with the process of birth. So if you're curious about Kundalini yoga, what I would say is to come along to a class and to see how it feels for you. Also, I think it's really important to emphasise that before you do any yoga class, you should speak to the person who's looking after you in your pregnancy, just to make sure that it's safe to carry on with the exercise. I've got quite a lot of experience in water birth. I've looked after quite a lot of women birthing at home, and often they use water as part of the process. I've also looked after women in birth centres who have chosen to birth in water, and I've looked after some women who are on the high risk labour ward, perhaps trying to have a normal birth after a caesarean, who are also using water for birth. Women choose it because they might feel that in being in the birth pool they have their own private space. It's much harder for people to do interventions on them that they might feel uncomfortable with because they have their own space. And often you'll see women getting in the pool and they relax because the buoyancy and the warmth of the water helps them to release of the tension that might have built up from the pain of labour. I think, like everything in pregnancy and birth, it's a really individual thing. So obviously, again, first of all, you would need to check with your care provider to make sure that it's safe for you to have a water birth, and also to think about whether it would suit you. But if you're a healthy woman, or if you've been told by your doctor or midwife that a water birth is safe and suitable for you, I would definitely say to consider it as a possibility, and to ask for it when you arrive in labour. Some women will get in and spend their whole labour and birth in the water, and some will go in and out. But I think it's definitely a helpful coping tool to think about, and can be a really positive experience. I think it's can be a really empowering tool for women. In terms of the research that's been done in water birth, there is quite a lot of good scientific research as well, more to do with labouring in water than birthing in water. So there's a series of articles called the Cochrane Reviews, which look at the best evidence around all kinds of medical interventions, and there's one of those for water birth. And what they found looking at all of the best quality scientific studies is that if you labour in water compared to labouring on the land, you have a significantly shorter first stage of labour. So that's from the onset of labour up to the pushing stage. It's significantly shorter, and that means that the shortening of the labour is very unlikely to be just down to chance. So it's probable that the water reduces the length of your labour. They've also found that women who labour in water experience less pain, as reported by the woman herself, and that they're less likely to need an epidural at any stage in the labour, and that the woman's blood pressure is likely to be lower. These effects aren't shown as strongly as the shortening in the length of labour, but they still have shown up repeatedly in these studies. With regard to actually birthing in water, there's not enough good quality studies to prove benefits or drawbacks either way, but there's no evidence that birthing in water is any more dangerous or risky than birthing on land. So it's very much up to how you feel at the time in your labour. Some women, when they come to the pushing stage, will come out of the water and feel that they need the gravity on land, and some women will feel that the water's really relaxing and that it helps them to birth the baby. You might not be advised not to have a water birth if there's any complicating factor in your pregnancy or labour that would make it dangerous for you or the baby to continue to be in the water. So this goes back to checking first of all with your midwife or doctor that water birth is suitable for you. If you start off labouring in the water, there might be some reasons that the midwife would ask you to come out. So, for example, if there was meconium in the amniotic fluid, if she heard anything abnormal in the baby's heart rate, or perhaps if there was bleeding or any other sign that the labour wasn't progressing normally. Because in order for water birth to be safe, we need to know that the labour is progressing normally and that the baby's coping well with labour. So those would be the times, if the midwife had any concerns about that, that she would ask you to leave the water. Yes, absolutely. For a lot of women who have had a caesarean in the past, it's possible to labour and give birth in the water if that's what you would like to do. I think check out whether it's right for your individual circumstances, because people have caesareans for all different reasons. But the only thing that needs to be different is usually we recommend that the baby's heart rate is continuously monitored when you're trying for a normal birth after a caesarean. And a lot of hospitals now have a monitor where you can put the monitor on your tummy and then still go in the water. And then it's the same as for anybody else having a water birth, that as long as everything continues to be normal with the labour and the baby's heart rate is normal, that you can go on. And what I've seen in my own practice is it can be really empowering for women who have had a bad birth experience in the past, that they can have that time in the water and feel that everything is normal and that they're doing things themselves this time. So again, speak to your midwife, but I think if you're considering a normal birth after caesarean, definitely ask about the possibility of a water birth. So we normally think about labour as having 3 stages, but if it's your first baby, actually the build up to labour is probably going to be the longest of all, and this is where you'll hear women saying that they were in labour for days, because the body has a lot of preparation work to do before the time that you would normally have a midwife or doctor with you in labour. So during this time it's really important, first of all, to know what's normal and what's not normal, and if you're not sure, to call the person caring for you and to make sure that everything's progressing okay. If they're happy with what you're telling them, then it's just a case of ignoring it as much as possible at this stage, because the contractions may be very irregular, they may come for a few hours and then go away again. So it's really important to rest and try and keep yourself as fresh as possible at this time. The first stage of labour, we normally say, starts from when the cervix is about 4 centimetres dilated and the contractions are regular and lasting about 45 seconds to a minute. And this stage of labour varies widely in how long it takes, but during this time what's happening is that the cervix dilates to allow then the second stage, the pushing stage, to happen. In an average first labour it might be about 12 hours this stage. The second stage of labour is once the cervix is fully dilated, and at some point once the cervix is fully dilated, if the woman doesn't have any pain medication, she'll feel an urge to push and to birth the baby. And finally, the third stage of labour is once the baby's born, when the placenta and the membranes are delivered. And this can happen either physiologically through the woman's own effort, or if there's an indication to do so, it might be managed with drugs to reduce the amount of bleeding. So we normally think about labour as having 3 stages, but with your first baby, the build up to labour is probably going to be the longest point before you're in the first stage of labour. And that's where you'll hear people saying that they were in labour for several days, because the build up when your body is preparing for labour can sometimes take that long. So the contractions might be very irregular, coming maybe only every half hour or every 15 minutes. Or they might come regularly for a few hours and then go away again. Check with whoever's looking after you that everything is going on normally, but if they're happy with what you're telling them, then the main thing at this point is to rest as much as you possibly can and to be fresh for when you actually get into established labour. So established labour, the first stage of labour, we say is from when the cervix is 4 centimetres dilated and when the contractions are regular and lasting maybe about 45 seconds to a minute. The length of this stage can vary widely between different people. For a first labour it might be about 12 hours, but it really varies according to the individual person. Eventually we get to the second stage of labour where the cervix is fully dilated, and once the cervix is fully dilated, at some point the woman will feel the urge to push the baby out, as long as she doesn't have any pain relief such as an epidural. Then the third stage of the labour is after the baby's born, and it's concerned with the delivery of the placenta and the membranes. This might be done physiologically using the woman's own effort if the labour's been natural up to that point, or it might be managed with drugs and managed by the person who's looking after the woman if there's a risk factor, so the drugs would be given to reduce the amount of bleeding. Perineal massage is basically a process where you prepare the perineum by massage for the sensations that you might feel when the baby's head is starting to be delivered. And it's good to have either like a printed instruction sheet, a book, or perhaps to go to antenatal classes like NCT or something similar so that you know that you're doing the technique correctly. There have been some studies about the benefits of perineal massage. And looking again at a Cochrane review, so a review of the best studies of this, what they found is that perineal massage is beneficial for first-time mums. So for second-time mums and onwards, it doesn't seem to make much difference. But for first-time mums, it reduces the rate of tearing and anything needing stitches around the time of birth. And they're not quite sure why that effect happens, but it has been shown to have a significant reduction in women needing stitches at the time of birth. And it also just helps you to prepare for the sensation of what's going to happen when the baby is born. If you have a disagreement with your midwife or doctor, I think it's important first of all to find out why they disagree with what you're asking to do, to hear any risks or any concerns that they have. if you still think that you'd like to go ahead with your birth plan, then the best way to go about it, first of all, is to ask to speak to a supervisor of midwives. Supervisors of midwives are available 24 hours a day in all hospitals, and this is a senior midwife who can act as a go-between between you and the people who have been looking after you up to this point. So her role is to make sure that you're happy with how you're being cared for, with the information that you're being given and the choices that you're being given, but also that you've had all of the information to make that decision. So that's the best person to approach. There's also charities and voluntary groups, and the most well-known one of these being the Association for Improvements in Maternity Services, AIMS, and this is a campaigning group for improvements to the choices that women are given. So if you really feel that the information and the choices you're being given in your local hospital don't match up to what you would expect, then you can go to somewhere like AIMS and ask them to help you to negotiate for the care that you would like to have.